Hi everybody, welcome to this section of Pharmacology lectures, General Principles of Pharmacology. This is the first one. In this session, the concept of pharmacokinetics and dynamics is covered. We will also discuss the role of bioavailability in dose calculation. We will compare and contrast some of the advantages and disadvantages of different routes of drug administration. Pharmacology deals with the study of drugs under two different components: the kinetics, which is all about the relationship between the drug dose and the plasma concentration, also known as what body does to the drug after administration, which is absorption, distribution, metabolism, and excretion. The second component of pharmacology includes dynamics. Pharmacodynamics is about the relationship between plasma concentration and the effect of a drug or action. What drug does to the body is discussed under dynamics. These are two important concepts of therapeutics in pharmacology. When we administer a dose, we will attain certain plasma concentration which will bring about the final beneficial effect with a minimal adverse effect, which is our main motive in therapeutics. And the relationship between dose and plasma concentration, as I mentioned, is discussed under kinetics, and the plasma concentration and effect relationship is covered under dynamics. So make a note here that plasma concentration is the central point of pharmacology because it brings two pharmacokinetics and dynamics concepts together. The kinetics is covered under the four different subheadings: absorption, within which we cover bioavailability. The drug gets distributed based on its affinity to tissues or the lipid solubility, gets metabolized by getting converted to water soluble for excretion. Bioavailability is our first component to discuss. It is described as the fraction or a percentage of the dose administered which reaches the systemic circulation. Ideally, our interest is to find out the concentration at the target site, which could be the CNS in meningitis. We cannot calculate or identify the concentration in the CNS always, and we are depending on the systemic circulation for our easy calculation. And this is what we cover in bioavailability, which is given by this formula: AUC oral multiplied by dose IV, AUC IV multiplied by dose oral. You make an important note here: when our dose oral and dose IV both are same, when we can cancel it out. And now I told you the dose oral and IV are same. When we give a same oral and IV dose and we try to calculate the area under curve, concentration is on y-axis and on x-axis we have time. This red color is for IV, area under curve, and the blue one is indicating oral, area under curve. And this is what we compare. And the area under curve oral over area under curve IV is bioavailability of a medication. And now make a note here. We have cancelled out dose because the dose used was same for calculating area under curve. There are times when we will see that when we administer a drug IV in the hospital and we get a certain plasma concentration which is calculated by this area under curve, and when send the person home, we want to administer the drug orally in such situation, and we want to attain the same area under curve. In other words, we want to attain the same area under curve, and because of which we are ignoring the area under curve. And the formula will become this. To calculate the oral dose, this is PO stands for oral, we will divide the IV dose by bioavailability. In other words, bioavailability helps in calculation of oral or IV dose if you know the bioavailability. Make a note of this. When we give the drug IV, all 100% is in systemic circulation, which is also denoted by fraction 1. This is tested in your exam. And now let's take an example to understand the bioavailability concept. What is the oral dose when we know the bioavailability is 0.8, this is in fraction, and we know the IV dose was given in the hospital was 400 milligram per day. And we are now interested to get the same beneficial effect when we discharge home by giving the oral dose which will attain the same area under curve or plasma concentration. This is oral. To get an oral dose, we need an IV dose here and bioavailability. You are dividing by bioavailability and we are getting this, the dose required orally. Make a note of this important point, how you calculate the oral dose. And let me walk you through the different area under curve graphs for 3 different formulations. We have 3 different formulations. One is A, B and C. These are 3 preparations. All of these 3 have, this is A, and B and C have similar area under curve. But each one has a different shape of the area under curve. Drug A is attaining a very high concentration above the desired, which can bring in some adverse effects, but it is being absorbed quickly. Such drugs are important for single doses which can be given for inducing sleep, but at a high dose there is a toxicity. Some drugs which are absorbed relatively slow, but they are attaining a decent therapeutic concentration for a significant period of time, and that is B. There are other drugs which are absorbed very slow and not reaching a therapeutic levels, so which is of less importance in spite of being administered. So each one has its advantages and disadvantages, and make a note of these 3. If we have a drug which is producing very high concentration with a very short half-life, we can make it controlled release or extended release by reaching the therapeutic concentration like the graph B here, and that is how we can improve the patient compliance. And now bioavailability formula is calculated by another interesting formula. This is F, which is the percentage or fraction of drug absorbed multiplied by 1 minus ER. ER is the extraction ratio, especially when we give drug orally, how much is being extracted, metabolized in the liver. So this effect of hepatic metabolism on bioavailability, oral bioavailability, described as extraction ratio. Watch out here. So hepatic clearance is in the numerator and hepatic blood flow in the denominator. When we give a drug orally, some drugs are heavily metabolized or cleared by the liver, and such drugs are called as drugs with high extraction ratio, and we have some drugs which have very high extraction ratio like morphine, lidocaine, which are, you know, metabolized in the liver significantly. And when we have a significant extraction in the liver or metabolism in the liver, then the bioavailability will be lower. Because as you see here, that if this extraction ratio becomes higher and higher, then 1 minus this higher amount will become, it is becoming closer to 1. As you can see in this case, 1 minus 0.7 is 0.3. So this is 0.3 is now multiplied by how much percentage absorbed, even if it is 100% absorbed. So it is only 30% reaches the systemic circulation, or this is the bioavailability. We have some drugs which have low extraction ratio like warfarin and phenytoin, which will definitely reach a high concentration. Let's walk you through different routes of administration. The first and foremost, the oral, which is common, convenient and non-invasive. But it has some disadvantages, like some of the drugs cannot be given, like here in unconscious individuals, because of the swallowing issues and aspiration. And some drugs like nitroglycerin have a very high first pass metabolism, metabolized in the liver, and also because of the gastric emptying time, which will take some time to reach plasma concentration, which will make it difficult to attain a quick action. So we will see different modes of routes of administration for such cases. IV route of administration is quick, can be used in emergency, but you need an expert. There is always a risk of thrombophlebitis, inflammation of the veins, and all 100% reaches the systemic circulation. The disadvantage is you need an expert, and in the hospital it is done, usually. Subcutaneous route of administration for drugs like heparin and insulin is having an advantage of smooth and consistent plasma concentration. The absorption is smooth and consistent, slow and consistent. Self-administration is possible. Of course, there is a pain. The advantage is self-administration. And now we will go to the transdermal route of administration. Drugs like nicotine, nitroglycerin are administered here. There is no first pass metabolism, or there is no liver coming in between before it reaches the systemic circulation. All the drug from the skin is entering into systemic circulation. So the bioavailability is quite good, but it is not as high as oral. There may be some amount of drug not absorbed or reaching systemic circulation. The disadvantage is it is quite often slow to get its effect, and the formulations are expensive, and only lipid soluble drugs can be administered by this route. We move on to the next rectal route of administration. These are some of the examples like acetaminophen, hydrocortisone, mesalamine, which are commonly administered by this rectal administration. Make a note here, the drugs which are given rectal are of two types. One is called suppository, which is the solid dosage form, and there is another which is enema, which is a liquid form. And by administering in the lower rectum, the drug enters into the systemic circulation, which is again not have to undergo liver metabolism. If we administer in the higher rectum above the pectineal line, then it will be undergoing metabolism in the liver, which I will show you here in this diagram. This is the pectineal line. As you can see here, the veins from here, the light blue here, is being carried to the systemic, the portal vein, and then to the systemic circulation. So this part undergoes first pass metabolism in liver, the superior rectal drainage, whereas this inferior and the middle one below the pectineal line is draining directly into the systemic circulation inferior internal iliac vein. So this middle and rectal generally constitute 2/3 for the drainage. So a significant part reaches the systemic circulation. Sublingual administration is done for certain drugs like nitroglycerin. Again, it is not depending on gastric emptying. The drug is absorbed from the oral mucosa directly into the submandibular vein and vena cava, and there is no liver or no GI metabolism. Quick in action, and bioavailability is definitely better than oral, definitely not as good as IV. This is all about some of the points related to the absorption part of the pharmacokinetics. Thank you very much.